Good afternoon, my name is Michelle and I am going to do demonstration of IV piggyback for school purpose. So I'm going to start by verifying the doctor order. So my patient is Renee Adams, birthday May 25th, 1978. He has no known allergies. The provider order, sodium chloride 500 ml to be administered continuously over 4 hours via gravity using 15 drops per ml tubing every 4 hours for hydration for 72 hours. By doing the math, he will be getting 31 drops per minute. He also ordered cefazolin sodium 1 gram intravenous piggyback to be given in 50 ml of normal saline over 30 minutes via gravity using 15 drops per ml tubing every 4 hours for urinary tract infection. By doing the math, he will be getting 25 drops per minute. So I am going to clean up my hands and grab my supplies. So I have sodium chloride 0.9%, 500 ml. Sodium chloride 500 ml to be administered continuously. So I have the medication. The expiration is September 25, so it's not expired. I also have my tubing, 15 drops per ml. Now I am going to check for my cefazolin sodium, cefazolin 1 gram and 0.9% sodium chloride 50 ml. The expiration date is March 2025. It's not expired. And I have my tubing of 15 drops per ml. So after I do that, I am going to bring my supplies at the bedside. I'm going to introduce myself to the patient and mention what I am going to do before I prime it, so I don't waste the medication in case the patient refuses. Hi, good afternoon. My name is Michelle. I am your nurse today. Can you please verify your name, date of birth? Renee Adams, May 25th, 1978. Renee, I am here because I have to give you some medication, some IV fluids, and an antibiotic intravenously. Is that okay with you? Patient agree. So I am going to do my second check. So I have sodium chloride 500 ml over 4 hours by gravity 15 drops per ml. So when I do my math, I come up to 31 drops per minute. I am going to open and I compare it to the medication, 0.9% sodium chloride 500 ml, and the expiration is September 25. I am going to check, make sure that it's not sediments, it's not cloudy, it's not leaking. So the integrity of my fluids are okay. I am also going to open my tubing. I'm gonna keep the integrity. I'm gonna use both hands so I can prime my line. We're gonna turn it upside down. I'm gonna remove the cover. Spike the bag. Fill up my chamber halfway. I'm gonna make sure this clamp is closed. Now I am going to open it up without removing the cap, just to make sure that is no, I prime the whole line. I'm gonna make sure there is no air bubbles. There is no air bubbles in my line. I am going to check again with my MAR. I have sodium chloride, 500 ml to be administered continuously over 4 hours. Via gravity using 15 drops per ml. So doing the math, it's gel for 31 drops per minute. Sodium chloride, 0.9%, 500 ml. My line is fine, is clean. So and now I am going to grab some gloves. Miss Renee, Mr. Renee, or Miss Renee, I am going to be assessing your IV. I'm gonna check for infiltration. There is no redness, no swelling. There is any pain, Miss Renee? They mentioned that there is no pain. So IV is not infiltrated. So I am going to grab my tubing. I am going to clean up the huff of my IV for 15 seconds. I'm gonna scrub. I am going to connect my IV. Now I am going to take off my gloves, clean up my hands, and I am going to do 31 drops per minute. Starting now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31. Okay, so now I am going to do my second IV assessment. I'm going to put gloves again. Gonna clean up my hands. Are you feeling any pain, Miss Renee? I'm assessing the IV. It's no swelling, no redness. So now I am going to take off my gloves and I am going to go and prepare my antibiotic. So the order is for patient Renee Adams, no known allergies, birthday May 25th, 1978. The order is for cefazolin sodium 1 gram intravenous piggy bag to be given in 50 ml of normal saline over 30 minutes via gravity using 15 drops per ml tubing every 8 hours for urinary tract infection. So I have 0.9 sodium chloride, 1 gram of cefazolin sodium. This medication is not expired. It's in March 2025. I also have my tubing, secondary tubing, 25 drops per ml. I am going to do my mat and my mat gel for 25 drops per minute. So I am going to open up my tubing. And I am going to verbalize again. Ms. Renee, do you have any allergies to antibiotics or any medications? Patient said no. I am going to inspect for integrity. There is no cloudy, no sediments, it's not leaking. I'm gonna turn my medication upside down. I'm gonna puncture the bag, spike the bag. I am going to close. So I'm gonna fill up half of the chamber. Because we're working with gravity, my antibiotic is gonna go higher. I am going to prime my antibiotic first. I'm gonna completely open it up just to make sure there is no air bubbles. Okay, there is no air bubbles on the line. I'm gonna hang it. I am going to go back to my patient. I'm gonna put up some gloves. I am going to reassess the IV axis. I'm gonna touch it and I am gonna ask, are you having any pain? There is no pain, no swelling, no redness in the IV axis. I am going to remove my gloves, clean up my hands again. And one more check. I have cefazolin 1 gram intravenous piggyback and 50 ml of normal saline, 0 point sodium chloride, cefazolin 1 gram. That is not, medication is not expired. I am going to grab my medication, grab an alcohol swab. I am going to clean up this port for 15 seconds. I am going to connect this IV because we're working with gravity. I am going to lower my sodium chloride lower than my antibiotic. I am going to close my sodium chloride completely, and I am going to open my antibiotic all the way up, and I am not going to touch it anymore. I am going to adjust the rate with my primary line. So I am going to be giving 25 drops. So I am going to be focusing in the chamber of my antibiotic. So I am going to start regulating this, and then I start counting. Slow it down more. Starting now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, and 25. So I am going to clean up my hands again. I'm gonna grab my gloves. And I am going to do my last IB assessment, just to make sure it's not getting infiltrated. So I am going to assess your IB, Ms. Renee, making sure it's not bothering you, it's not hurting you, and it's not infiltrated. So Ms. Renee, do you have any pain? My patient stated it doesn't have any pain. Ms. Renee, there is anything else that I can do for you before I leave the room? My patient said no. I will come back and check on you in a little bit. Please call me if you have any discomfort. Thank you.